November is Lung Cancer Awareness Month, and there's a new report highlighting disparities among communities of color impacted by the disease.
That's right. The American Lung Association released its annual report today showing the toll that this disease has on each state. And overall, the survival rate has improved nationwide, but it remains significantly lower among Black Americans.
Survival overall nationally to reach 5 years is almost 24%. Among people of color, that's 20%, and among Black Americans alone, it's only 18%.
Compared with other states, D.C. is among the worst in the nation for early diagnosis and treatment. Maryland ranks among the best in the nation for lung cancer survival rates and treatment, while Virginia ranks above average for people receiving any kind of treatment. Lung cancer remains the leading cancer killer among men and women in this country. But as News 4's Doreen Gensler reports this evening, a new treatment is giving some patients hope in their fight against the devastating disease. Hi, Doreen, tell us about that.
Hi, Leon and Pat. We know that chemotherapy drugs are effective, helping to kill cancer cells, but they can also damage normal tissues, and the side effects can be unpleasant and even debilitating. This new FDA-approved treatment works by stopping those side effects from happening in the first place by protecting the healthy cells before the chemo begins.
After being misdiagnosed twice, through an X-ray, they finally found a tumor the size of a cantaloupe.
Montessa Lee says she was in shock when she was diagnosed with small cell lung cancer at the age of 28. She's never smoked and has maintained a healthy diet. Soon after the diagnosis, the special education teacher underwent 6 rounds of radiation and chemotherapy to treat the aggressive tumor. She says the side effects were debilitating.
I experienced hair loss. The chemotherapy impacted my hearing. At 28 years old, imagine going from an active life to barely being able to walk around my apartment complex without feeling like I was exhausted. My legs felt like weights.
That treatment saved her life. Now, more than a decade later, she's turned her experience into advocacy, sharing the importance of early detection and treatment. Every year, more Americans will die from lung cancer than breast, colon, and prostate cancers combined. The disease can go undiagnosed for a long time because symptoms don't often appear until the cancer has spread to other parts of the body.
We've made more progress in lung cancer in the past 5 to 7 years than the previous 30 years combined.
Dr. Vincent Lam is an assistant professor of oncology at Johns Hopkins University and says part of that progress means more treatment options, including a new FDA-approved drug called COSELA that works to limit the side effects caused by chemo, making the therapy safer and more tolerable.
Unfortunately, there can also be some collateral damage in that good cells are often impacted, such as your white blood cells that help fight infection, or red blood cells that help carry oxygen throughout our blood. So this new treatment is given before chemotherapy is started, and in a way temporarily puts the good cells to sleep so that they can be protected from the collateral damage.
Dr. Lam says the drug is given through an infusion up to 4 hours before someone gets chemotherapy, using science to help patients withstand chemo in their fight against this devastating disease.
Our patients with lung cancer are living longer than we've ever seen, and that's because of research.
I'm happy to tell you Montessa Lee has been cancer-free for 15 years now. COSELA is so far only approved for patients with small cell lung cancer, but Dr. Lam tells us clinical trials are underway to see if this same approach could one day be used to help people battling other kinds of cancers like breast, colon, and bladder cancers. So this is certainly good news, and the implications for the future pretty significant.
Just phenomenal to see the speed at which these developments are coming out. 5 years, we've had as much progress as in the previous 40. That's amazing.
It really is amazing.
Very hopeful. Thank you, Doreen. Virginia recently announced the launch of expanded